The internet is full of bro science, fake knowledge, half information, or propaganda. Your quest of reliable, authentic health information ends here. So subscribe this channel and hit the bell icon, and you never have to go anywhere else ever again.
Hello everyone, how are you today? I am Dr. Paramjeet and you're watching Dr. Education. Today we are going to talk about cancer. What is cancer? And we are going to see what causes cancer and how we diagnose, what are the symptoms of cancer, what tests are done, and finally what is the overall treatment of cancer, and what and how can you prevent cancer. So this video will encompass the general idea of cancer as a full scope explanation, right? So let's just discuss about cancer. See, cancer is an uncontrolled growth of abnormal cells in the body, and cancerous cells are also called malignant cells. What causes cancer? See, cancer grows out of cells which are already present in the body, right? Normally, cells multiply when the body needs them and then dies when they are damaged or when body does not need them, right? Cancer appears to occur when the genetic material of a cell becomes mutated, changed, right? This results in the cells growing out of control, and cells divide very fast, very quickly, and do not die in the normal way. There are so many kinds of cancer which grow like this, right? And cancer can develop in almost any organ or tissue in your body, right? Like the lungs, the colon, breast, skin, bones, nerves, nervous tissue, anywhere, right? And therefore, we basically see what are the risk factors for cancer, right? And there are many risk factors of cancer, right? For example, drinking too much or drinking too heavy alcohols, right? Then chemical exposures like benzenes, environmental toxins like some poisonous mushrooms, some types of molds that can grow on peanut plants and produce toxins like aflatoxins, some genetic problems, right? Obesity is a risk, radiation exposure is a risk, like too many x-rays, too many CT scans or radiation in a radioisotope scan or any kind of radiation exposure. Too much sunlight exposure for that matter also has a risk, right? Viruses, viral infections have a risk of cancer. So the cause of many cancers are actually unknown also, right? And most of the causes of cancers related to cancer-related deaths, most of the causes, cancer-related deaths are due to lung cancer. Lung cancer is a very dangerous cancer, right? And skin cancer is also very common and very commonly diagnosed. And apart from skin, the three most common cancers are prostate cancer, lung cancer, colorectal cancer, and even breast cancer is very common. So, and what else? Some cancers are more common in some part of the world. Like Japan, stomach cancer is more common. In US or in America, stomach cancer is less common. And there can be actually many types of cancer: cervical cancer, Hodgkin's lymphoma, kidney cancer, leukemia, liver cancer, non-Hodgkin, ovaries, pancreas, testicular, thyroid, uterine, kidney, or oh my god, so many. Any tissue can have cancer. So how will we diagnose cancer, right? What are the symptoms? See, symptom of a cancer depend upon, number one, the type and location of the cancer. For example, if it is in the lungs, you can have coughing, shortness of breath. You can have chest pain also. Then other example, if it is in the colon, then cancer can lead to, colon is your intestine, large intestine, then the cancer can lead to diarrhea, constipation, and even blood in stools, right? So we have to see, symptoms depend upon the system involved, right? Some cancers may not have any symptom at all, and in certain cancers such as pancreatic cancer, symptoms often do not start until the disease has reached to a very advanced stage, right? So most symptoms, well, see, many cancers can present in variety of symptoms. Like sometimes people may have chills, fatigue, fever, loss of appetite, malaise, night sweats, pain, weight loss, something like that. So we have to do tests if we think there is a possibility of cancer. So whenever you go to a doctor with these symptoms or a risk or a history of cancer, family history of cancer, then we do some tests to find out the type and location of the tumor cancer. Most commonly done tests are, number one is if we know that there is a tumor, there is a growth, then we do a biopsy of the tumor, right? Then we do blood tests which actually look for chemicals like tumor markers. Tumor markers are increased, and there are so many various types of tumor markers which are specific to certain types of tumors, right? Then sometimes if there is a blood cancer, lymphoma or leukemia, then bone marrow biopsy is done, x-rays are done, complete blood count is done, sometimes CT scan is required, liver function is required, kidney function is required, sometimes MRI scan or PET scan is required to see if the cancer has spread to certain areas or not, right? Has spread to other tissues, right? So most cancers can be diagnosed by biopsy. That's why very important. And depending upon the location of the cancer, the biopsy may be a simple procedure like or it might be a serious operation of the biopsy. If you have to do a brain biopsy, it's a very serious condition, right? Serious procedure. So most people with cancer do have a CT scan, right, to determine the exact location and the size of the tumor. A cancer is diagnosed very often, but no, the diagnosis of cancer is very difficult, right? And it is difficult to even cope with the diagnosis for the patient. So it's very, very important for the doctor to be gentle and important for discussing all the treatment options, right? Then it's actually, we'll make a different video on this, right? How to cope with cancer. Then treatment of cancer. See, treatment varies. It is based on the type of cancer and its stage, right? The stage means how much the cancer has grown and whether the tumor has spread from the original location or not, right? That is the stage. So if the cancer is in one location and it has not spread, the most common treatment approach is surgery. You have to remove to actually cure the cancer, right? In that case, this is often the case with skin cancers, right? As well as cancers in the lung, breast and colon. If you have lung, breast, colon or skin cancer, mostly surgical excision, wide excision is done. That means wherever the tumor is, we excise somewhere 3 to 3 centimeter wide areas to actually cover all the edges so that all the cancer tissue has been removed. Even if one cell remains, the cancer can restart and spread. Okay, if the tumor has already spread to a local lymph node, right? Obviously, cancer can spread through blood, through lymph node, through local invasion. So if it has gone to a local lymph node only, then sometimes these lymph nodes can also be removed during the surgery, right? And it's easy to do that. It's good to do that, but then sometimes for diagnosis also sentinel lymph nodes are removed, especially in breast cancer cases, right? And if the surgery cannot remove all the cancer, say the cancer has spread to various places, sometimes to the bones, into the blood or into other organs, then we have to opt for other treatment options like radiation, chemotherapy, immunotherapy, targeted cancer therapy and hormonal therapy, right? Or other types of treatments, whatever is available, right? This all treatments basically target to reduce or stop the cancer from all these therapy and other different angles, right? Some cancers will require combination of therapy, right? Chemotherapy, immunotherapy, radiation therapy are the most common. They are often used, and these are very commonly used, right? See, treatment of cancer can be difficult, but there are many ways which will help you to cope, and it's very, very important to concentrate on your health during and even after the treatment. So we're going to make a video on that also, right? Because see, if you are having on radiation therapy, then you have to allow that you take plenty of rest, eat well balanced food, right? And obviously skin which is treated will become a little sensitive by the radiation, right? So you have to understand that is temporary, and you have to talk to your doctor about it. If you're taking chemotherapy, then you have to obviously eat right, also take a lot of rest. That's the most important, right? And you have to avoid other diseases, right? Secondary infections, you have to avoid cold, flus, right? Because during cancer therapy, your immune system will become weak, right? So you have to keep in touch with your doctor. So how to prevent cancer, right? Can you prevent? Yes, you can reduce the risk of getting a cancerous tumor. Number one, by eating healthy foods, exercising regularly, right? Limiting your alcohol intake, maintaining a healthy weight. It's very important. And then minimizing your exposure to any radiation, even the sun or any toxic chemicals, say any chemical plant near your area, or chemical factory. Then not smoking or chewing tobacco, both causes, they have 7,000 chemicals which can lead to cancer. Then you can reduce your sun exposure, as I already said, right? And most importantly, you need to undergo cancer screenings. Like for females, they should undergo a mammography and breast examination for breast cancer. For colon cancer, we do colonoscopy, right? These things can help catch the cancer at early stages when these are the most treatable. They can be removed completely, right? And people who have a higher risk for developing cancers, they can even take medicines to reduce their risk. There are certain medicines which you need to talk to your doctor if you have a risk, right? So this is overall general idea about cancer. Hope you like the video. Don't forget to share this knowledge, right? It's very, very, very important for people to understand the basics and even the depth. We're going to make videos on each and every type of cancer as the time goes, right? So make sure to follow this series and make sure to share this information. It's very important. If you like the information, do give us a thumbs up, and I'll see you tomorrow next time. Stay connected, stay healthy.